For chronic conditions like, let's say, arthritis of the shoulder or the knee, a lot of people will say, well, do I need a joint replacement? And most of the time the answer is when you're ready for it or when you think you need it. There's certain conditions like ACL tears or rotator cuff tears that we obviously have to fix with some urgency. But the answer to the question, hey, when do I need to do this, is kind of, you'll tell me, basically. So when your quality of life suffers, when the treatments that we have are ineffective, and when you can't do what you want to do, that's when it's time to do something more about it. And that's kind of a hard concept, I think, for some people to understand. It's kind of like, well, I came here for you to tell me what to do. And it's like, okay, I can give you my advice, but I can't really tell you when you're ready. And it kind of has to be something that patients consider, think about, understand the recovery from, and really kind of make their decision for themselves. Of course, with our assistance, we can give advice. I can tell people what I would do, but it really comes down to, how much of a problem is this for me, and what do I want from my shoulder, knee, etc. What do I want to do, and how can I get back to that? And like I said, we can give our input, but it really comes down to, hey, what would you like as a patient? So that's, I think, a big one that I often talk to people about, is just the philosophy would be, let's kind of do what you think is best for yourself with, our input, basically.